Now, on the seventh discussion we'll be having is on the issue of rational drug use. So, rational drug use, let me just give you guys a summary of what rational drug use. Rational drug use is more of like, I'm not using drugs anyhow. I'm using drugs that are being prescribed by a healthcare provider. I don't know if you understand. Everything I'm using is actually being recommended to me at the particular dosages and all of that. I'm not just saying I have headache, let me go and buy antibiotics. No. I'm being examined, and everything is being prescribed properly. So what are the advantages? Of course, if you are doing things good, everything is of what advantage to you. Do you understand? So let's have a summary of what rational drugs use is before we look at the advantages. So first, rational drug use means the patient is receiving medicines appropriate for their particular need. Do you understand? In the correct dose, for that adequate time, and the lowest possible cost. So when practiced consistently, it strengthens the healthcare system because sometimes issues of drug abuse and all those overload, it comes back to the healthcare system again. Do you understand? So it reduces the load on the healthcare system. So it improves patient outcomes, ensures that the patient is getting the right medicine for the right condition, reduces treatment failures and complication, enhances recovery and quality of life. Okay? Alright, so it reduces the risk of drug resistance. So let me just give you guys this thing. Okay, well, the example that I wanted to give is even here. For you guys, I actually just buy antibiotics and antivirals by yourself. Sometimes you might not take it well, and sometimes it might not kill the organism. So the organism is rather sensitized that okay, actually this type of drug actually exists, and they get to resist it more. It also helps to preserve the effectiveness of existing medicines. So it's cost effective. If somebody is advising you on the right drugs to buy, it avoids issues of you are trying to try out, you are trying to make guesswork. Do you understand? So it enhances safety, so it minimizes all those adverse drug reactions and harmful reactions. It protects the patient from what's inappropriate or excessive dosing of drugs. So efficient use of resources, it prevents wastage of what scarce medicines. It strengthens the healthcare system, so it makes it that the health facilities are in control. I don't know if you understand. And of course, they are supposed to be in control because you are the patient, you know. So it builds trust in the healthcare facilities when patients are consistently receiving what effective treatment, because it reduces all those law cases. Right here and there, I see people suing this particular hospital, suing this because of issues that came up. So equity and accessibility. So it actually makes that what all groups of people in a community, the rich people, the poor people, at least they are having access to the basic medicines they need, which is actually a way of life. So that's it for the advantages.